Good morning, everyone. Welcome back to Epidemiology and Community Health seminars. It's good to see you. We've got some new faces here. As we switch up the topics and types of speakers, it's nice to see new faces according to those topics. So it's very nice to see the infectious disease folks on the call today. In addition, I'd like to welcome some of our undergraduate students who I see popping up here. So this is a topic very, very close to the heart of lots of folks around here. And we're so happy to have Dr. Talia Quandelacy with us today. I've just got one quick announcement. As you may know, for those of you in our division, you received an email from me 2 days ago saying that we've got 3 seminars left for this school year, including today's. So next seminar is by Dr. Julia Joseph DiCaprio, who is a former student in a maternal and child health program, but as you know, a leader in clinical medicine and public health in our area now. She is going to come and speak to us about anti-racism. Let me get her title up here. Oh, I might not have it anymore, but if you're interested, please do come back next week. It is, I'll put it in the chat box later. It is also a seminar that is co-hosted by our Center for Anti-Racism and Health. So then our last seminar speaker will be Dr. Julian Wolfson. That will be a seminar that's co-sponsored by the Division of Biostatistics in our School of Public Health. And he'll be speaking on mHealth, mobile health. mHealth, is it mHope or mHype? So we'll finish the seminar series with Dr. Wolfson that week in 2 weeks, and we will have a break over the summer. In the email, I also asked you for some suggestions for next year, whether they be topics or particular speakers, or perhaps co-sponsored events with other entities, which have gone very well for us this school year. So I highly encourage you to think creatively and wholeheartedly about those suggestions. In the email that I sent, there is a survey in order for you to drop your ideas. And I think Barb can help us out and drop that survey spot into the chat box today as well. So our speaker today was brought to us by a mutual connection, and that is Dr. Kumi Smith. So Dr. Kumi Smith is going to be giving the introduction today. Kumi, thank you so much for doing the introduction, and thank you so much for getting Dr. Talia Quandelacy here.
Great, thanks, Ruby. Hi, everyone. It's nice to see you all. If you don't know me, I'm an assistant professor in the Epi and Community Health Division, and it is my distinct pleasure to introduce Dr. Talia Quandelacy today, who is a really baller infectious disease epidemiologist, but also a really good friend, also of Kelly Searles, who's on here too. So we're just excited in multiple ways to have her here today. So Dr. Quandelacy is currently an assistant professor at the Colorado School of Public Health Department of Epidemiology. And like I said, baller, I'm not kidding. So she's been a member of the CDC's COVID response modeling and forecasting team. She's been part of the Colorado School of Public Health COVID-19 modeling team. So a ton of, not just modeling, I think a lot of infectious disease dynamics methods and the whole entire suite of methods that come with that is really what she focuses on. Substantively, her research focuses on the transmission dynamics of respiratory and arboviral diseases, so vector-borne diseases, and looking at how these disease patterns change across space and time. So today she'll be talking a lot about dengue, which is a high morbidity, high mortality disease that's been well described in Southeast Asia, but not as much in Latin America, where a lot of Dr. Quandelacy's research focuses. So we're really excited. Thanks for coming, Talia, and we look forward to a Q&A toward the end of this session.
Thanks for having me. I'm really excited to present my work today. So I will be talking about, sorry, let me get this window out of the way. Okay. So I'll be talking today about the seasonality and forecasting of dengue in the Americas, and this is work that I've done as part of my postdoc at the dengue branch at CDC, and really hoping to just show you kind of what we can look at with disease surveillance data and really how we can understand and identify regional patterns across the Americas region. So I'll start with a little bit of background on dengue. So it's a mosquito-borne disease that's caused by the dengue virus. It's transmitted by these Aedes species mosquitoes, specifically Aedes aegypti, which is in the figure on the right side, and also Aedes albopictus. It is a flavivirus, and there are 4 related serotypes, so dengue 1, 2, 3, and 4. And when we think about where the highest risk of dengue is, it is predominantly in Southeast Asia, but has also been documented to have frequent risk in countries in the Middle East and also some countries in Eastern Africa. But as you can see, there's actually a substantial burden in the Americas region, including the Caribbean. From one modeling study, there's an estimated 96 million infections per year among those at risk in 128 countries. So really a fairly high burden of disease, and oftentimes this impacts younger age groups more often than adult populations. In thinking about how dengue is transmitted, it's, it is a mosquito-borne disease, so it often starts with an uninfected mosquito biting an infected adult. This mosquito then undergoes a short incubation period and becomes infected with the virus. It then bites a healthy individual. That person then experiences an incubation period, roughly 3 to 14 days, and then becomes infected, and the cycle then continues. And when we're thinking about the disease spectrum, a fair proportion of infections are actually asymptomatic. So at least 80% of infections go undetected. A person never really experiences symptoms, but a smaller proportion, about 20% or so, are actually symptomatic. And those who do experience symptoms have a wide range. They can go from fever to headache. There's usually a classical rash along with some muscle pain, bone pain, or joint pain. And symptomatic dengue is usually experienced upon your first infection. But you can experience more severe disease, and that's what we classify as this category called severe dengue, which is what we used to call dengue hemorrhagic fever and dengue shock syndrome. This oftentimes happens upon your second infection, and often by a different serotype from your first infection. And this can result in symptoms such as shock, severe bleeding, severe vomiting, or stomach pain. In thinking about, the transmission dynamics of dengue, it's useful to see a visual time series of this. And so this figure here is showing a dengue time series from Puerto Rico. So the x-axis is time and the y-axis are the cases. And you can see that there are kind of annual oscillations of cases. So, peaks every year, but there's also noticeable years where there's these large scale dynamic epidemics that are happening. And these don't necessarily happen every year, but really kind of seem to cycle roughly 3 to 5 years. And so when we think about how dengue spreads at a population level, it's important to think about what causes these, or what is, in other words, drives these types of population dynamics. These include aspects of the vector, so something like the abundance of the mosquito or the geographical range of the species that actually transmit dengue. Climatic factors, so there's a real relationship between changes in temperature and the replication cycle of the mosquito, but also the replication cycle of the virus itself. Also, fluctuations in rainfall have an impact on transmission of dengue, as well as longer term or severe events, and something like El Nino, Southern Oscillation events, so changes in sea surface temperatures over longer periods of time, have also been shown to impact dengue. I won't talk about this too much in this talk, but it's important to note the viral evolution, so changes in the virus itself and also changes in this prevalence of the serotypes have an impact on our population immunity to dengue, and that also influences these transmission dynamics. And then finally, human and sociological factors, so things like demography, changes in birth rates and life expectancy impact the underlying susceptible population for dengue, but also things such as shifts in terms of where people live. So if there's more people moving into urban regions, changes in urbanicity, or also the movement of humans. So if there's travel, either at a seasonal scale or kind of longer routes from different countries that can import dengue to new regions, those also impact transmission dynamics of dengue. And in thinking about different types of patterns, I mentioned there's kind of these annual cycles, and that's what we would call seasonal dengue dynamics. These are really thinking about kind of within a year, what is the pattern of dengue? Oftentimes the factors that really contribute to this are human movement. So if there's seasonal migration from one place to another, that can also bring with it dengue into different areas and kind of move it back from different locations. But also, there's climatic variation as well. So, temperature changes throughout the year, and so does rainfall. And so we can see that there's some impact of that as it relates to dengue patterns. The two figures are showing the within year dengue patterns. And so the first figure is showing an example from Southeast Asia, where you have at least some countries that have dengue that tends to peak in kind of the months of August to September. But if you move kind of across the space, you'll see that in other regions, such as in Cambodia, you tend to have dengue peaking in the summer months, kind of denoted by this dark red in this color legend. And you can see something similar when we're looking at other regions. So this figure on the right is from Brazil and showing different states within Brazil and kind of the incidence of dengue. So the dark red showing periods of high dengue incidence across different months. And you can see there's kind of a clear shift as you move from Acre to other regions such as Sergipe or Alagoas. As you mentioned, there's major epidemics that tend to happen over a time series. These are what we tend to call multi-year dengue dynamics, a kind of longer term dengue dynamics. Again, really referring to these really large epidemics that we see not every year, but really every 3 to 5 years. If you look at the time series where these arrows are pointing, are kind of highlighting where these large epidemics are happening, and you can see that they seem to happen on a longer term basis. There's been some research that has shown that El Nino Southern Oscillation, so the changes in sea surface temperatures, do seem to have an impact on when these epidemics arise. There's also been other changes in temperature that also seem to be driving some of these epidemics, with most of the research that's supported this being from Southeast Asia, Mexico, and Puerto Rico. So I think given that a lot of what we understand about dengue has been conducted in Southeast Asia, given that there is such a high burden of disease in the Americas, we were hoping to ask a fairly simple question, which was really just what are the regional dengue dynamics in the Americas region? Within that, looking at what do the seasonal patterns look like? What are, some of these longer term patterns? Do we see if there are regional epidemics happening all at the same time within a year, or are they kind of more sporadic? And are there potential drivers such as temperature, El Nino, big changes in the underlying human population, or the introduction of a serotype that might explain these patterns that we're observing? And so in the Americas region, we relied on the use of dengue surveillance data. Most countries have been routinely collecting dengue cases since the early 2000s. I think there's Mexico, Brazil, Puerto Rico, and the Dominican Republic have had surveillance in place since roughly the 1980s. But all of these countries report routinely at least aggregated weekly or monthly counts of symptomatic dengue cases. And this data oftentimes is publicly available at the country level, but in order to be able to understand smaller scale patterns of dengue, such as at the subnational level, that requires some collaboration with the ministries of health to be able to access and visualize that type of data. And given that, this is surveillance data, it's passively reported. So there are some considerations with using this type of surveillance data, which is that, there's variations in reporting. There might be some reporting biases or changes in the surveillance system over time, case ascertainment, but also these are, total counts of dengue cases. So we don't have any other information about, what age these individuals are getting infected at, or what type of serotype they're being infected by. So we worked with we worked with a number of ministries of health and academic collaborators, and were able to collect data from roughly 14 countries. And so we have surveillance data from roughly 239 locations. So this figure here is just showing a visualization of that data. It's ordered from the most northern latitude, which would be in Mexico, and goes down to the most southern latitude, which is data from Argentina. And each line represents a location and the normalized incidence of dengue for that particular location. So red being periods of high dengue incidence and blue being periods of low dengue incidence. And from this data, you can see that there's even just, from the raw data, you can see that there are some kind of red bandings that seem to happen every single year. And that's indicative of kind of the seasonal patterns of dengue, but also for certain locations and for certain years, such as in 2010, you kind of see a lot of red banding across the entire region, maybe indicative that there was a large epidemic at that time. But this is the type of data that we have, and we can actually visualize seasonal and these longer term patterns using an approach that we call wavelet analyses. So, one of the questions that we had was to look at what the seasonal patterns are and also the long-term patterns. As I mentioned, we can process our data in order to isolate these types of patterns. So what we did was we took these original dengue time series. I think this example is from the Yucatan in Mexico. We can normalize it, which allows us to at least compare these dengue patterns across the entire region, just given there's a huge variation in the magnitude of dengue across these different locations. And then we can isolate kind of the patterns that are of interest to us. So we considered like a seasonal pattern ranging from roughly 8 to 16 months. And we can isolate that pattern in the time series, which is this blue line that's overlaid on the normalized time series. You can see kind of the strength of these oscillations and that they happen roughly every year. We can also look at what these longer term cycle patterns look like. And we've kind of defined a wide window of what a long-term cycle is, but really ranging from 24 to 60 months. So that's equivalent to 2 to 5 years. And when we extract that type of a pattern, we can see that there isn't this like seasonal oscillation, but really you see peaks that seem to be happening every few years. When we overlay that onto this normalized time series, you can see this roughly follows some of the larger peaks that we see in the original time series, but allows us to see if there's longer term cycles of large epidemics that are happening both in a location and across the region. So this is just showing the seasonal time series for all of the locations. So showing what this looks like across the region. Again, a heat map where we're now the color scheme is reflecting what we're calling the seasonal wavelet coefficient. So the red is showing periods of high kind of seasonal dengue incidence, and the dark blue is showing periods where dengue incidence and the annual dengue incidence is really low. And you might notice that there's some more gray on the two ends of the time series, and that's because we accounted for edge effects. So we excluded the first and last years of our data in this analysis. But what we really see standing out is that there's fairly strong seasonality within at least these countries. You can see kind of within subregions that there seems to be fairly similar timing of when these patterns peak and also when they have low periods. But also we see that as you move from the northern countries down to the southern countries, we also seem to see a shift in the timing of this as well. This is just to help visualize the data, but we can also actually estimate when these peaks are occurring across the region. And so that's what we've done here. So we took these time series and estimated kind of what the average seasonal pattern looks like within a year for every location. When we do that, we can get an estimate of when dengue is peaking within a year for every location. And then we've plotted that on this map here. So this figure is showing the month that we see a peak in seasonal dengue, with the red being earlier months of the year. So from January to May, and then the blue being from later months, really June to December. And what we see, which is pretty striking, is that there's shifts in the peak of dengue moving from earlier in the year in the southern hemisphere up to the later months in the northern hemisphere. And that, seems to correspond with the shift once you pass the equator, but it's really interesting to see kind of how stark that change is. We can also do a similar analysis that looks at the annual patterns of temperature and see when that peaks. And that's useful to know, just given the relationship between temperature and both the mosquito, but also dengue. And we've estimated that, there's roughly a 2 to 3 month lag. So when we see temperature peaking, roughly 2 to 3 months after that, we then see peaks in dengue occurring. And that isn't so novel, but it's at least useful because that's also been evaluated in other locations, such as in Southeast Asia and Thailand. And this also helps to confirm that this is a similar trend that we see in the Americas region. So as I mentioned, we can look at what the average seasonal pattern within a year looks like for dengue within countries, but also across countries. So just taking Mexico as an example, each dot in this pattern is kind of the estimated seasonal coefficient for a given month for a location. And each of these lines corresponds to a location within a country. And so you can see that for a number of these countries, the subnational locations within these follow very similar patterns for the most part, though there is some heterogeneity within countries, such as in Venezuela and Colombia. At least in the instances of these two countries, that is often driven by geographic variation. So the Amazon region also goes through Colombia, and that seems to explain some of this heterogeneity that we're seeing, but also population differences that we might expect. But also we see that there's quite a bit of difference in the timing and kind of maybe the magnitude of some of these peaks as you move from one country to the next. So showing that there are shared seasonal patterns, but some heterogeneity as you compare across countries. So those are some of the seasonal patterns of dengue that we've seen across the region. We can also look at what these longer term patterns look like. So, in order to do this type of analysis for longer term trends, you need at least 10 years of data in our, and you saw in our original kind of figure that there's a wide range of data available from each country. So what we did is we took the countries that had at least 10 years of data, which is roughly 9 out of the 14 countries in our study, and evaluated what their long-term trends look like. And to account for edge effects, again, we excluded the first and last 3 years of our time series. But what we see here is that even within kind of the smaller subset of data, we see that within countries, there are seemingly some epidemics that seem to happen within a country and kind of across that country around the same time. So one nice example is in Mexico, around between 2002 and 2003, you kind of see a banding going across most of these states. But we can also start to see if there's maybe subnational epidemics or kind of synchronized large scale epidemics happening across the region. And then we can start to ask if these are corresponding with different events, such as an El Nino year or maybe a serotype introduction. And we can see that, and we can see that at least in 2007 to 2008, there's a bit of banding that goes across the countries from Brazil to Costa Rica, but also really kind of more striking is between 2010 and 2011, we see this kind of really dark banding or kind of a long banding across the entire region. And we're investigating right now if that's related to a serotype introduction an El Nino year, or if it's kind of a combination of events that cause this synchronized epidemic. So we can use the information from this type of seasonality and kind of long-term trend analysis to understand what types of patterns there are across the region, but it can also inform an approach to be able to forecast dengue across the region. And the reason that forecasting of dengue is necessary or useful is really that it can help us to plan for the implementation of primary prevention measures. And if there's enough time to do this sufficiently, then we can really implement risk reduction, such as behavioral campaigns or public health educational campaigns, and also the implementation of vector control. So for example, insecticide spraying, which is this figure below. But it also allows for secondary prevention measures. So things like hospital staffing and capacity. Do we have enough doctors available at that point in time to treat patients who get sick with dengue? Are there enough hospital beds available at that time? And something like that is actually pretty important because dengue doesn't have an actual treatment for it. Usually treatment is palliative, and so it's important to really reduce your chances of getting infected. So given what we observed from our seasonality analysis, we saw that there's strong seasonal patterns. So that helps kind of inform what types of indicators we might want to use to forecast dengue, but also shows that there is a bit of heterogeneity across the region. So one of the things that we're aiming to do is to see if we can identify common forecasting indicators that work well across the entire region. This helps us because then we can present kind of a common model that works well across regions, and for the countries that we're working with that have an interest in implementing a forecasting as part of their surveillance system, we can provide them with some guidance for what might be a good starting model. Not only is this useful for at least forecasting, but if we see that there are certain indicators that seem to be important across all of the region, this might tell us something about what potential drivers of dengue transmission dynamics are within different countries, or if we see one commonly across the region, potentially, a geographic, a larger scale driver of transmission dynamics. So those are kind of our two main questions of interest. And then finally, we're also interested in, for forecasting skill, what factors might impact different models, and are there things that we can account for to reevaluate the forecasting skill of our different models? So what we were interested in doing was forecasting monthly dengue cases. This time we are interested in logging these dengue cases just to account for kind of nonlinear patterns over time. And so we're using, again, most of the data from all of our 14 countries. And given that there's such a variation in the length of the time series available across different countries, one thing that we were interested in was at least trying to compare how forecasts across a similar time frame for all of our countries performed. So because of that, we looked at what the overlapping time frame of our data set was, and it was really the years between 2010 and 2011. So we used 2011 as kind of the cutoff mark for how we split up our testing and training data. So for our training data, we used all of the data prior to 2011 to build a number of linear regression models. And then for our testing data, we used all of the data from 2011 onward to do our out-of-sample validation, where we forecast cases of dengue for each month for each location in our data set. And we're interested in forecasting time horizons of roughly 1 to 6 months ahead in time. So I mentioned we use the training data to build a number of linear regression models. We were interested in evaluating a number of indicators, both individually and in combination. And so the indicators that we were interested in using were roughly in 3 subsets, but the first was using dengue itself as an indicator, and using 2 local indicators of dengue. So for a given location, just what is the average what is the past average cases for that location. And that's really what we're calling a reference model. Looking at the dengue cases from the month before in a given location, we're kind of calling as an AR1 model, and the time series, an example of the time series is right below that. And then thinking about, a regional dengue indicator. So we've created a metric that we're calling the lagged weighted regional time series, which is really taking the number of dengue cases across all of our locations for a given month, getting an estimate of that weighted by the population estimates of all the different locations available in our time series at that point in time, and giving us some sort of time series that is reflective of what is happening across the region with dengue. And so that is what this time series right below looks like. We also used a seasonal indicator, which is really just a calendar month modeled kind of as a factor term ranging from 1 to 12 months. And that helps just to account for some other temporal variability. And then lastly, we looked at a number of climate indicators. So for a location, we looked at the average monthly temperature and lagged that by 2 months. And that's really informed by some of our seasonality analyses. We also looked at average monthly temperature, average monthly rainfall, which is this green time series below. And then finally, we looked kind of at a regional climate indicator, which is this multivariate El Nino index time series. When we lagged that by 6 months, and that's the time series below. So we looked at all of these indicators both individually and in some combination, which you'll see in the coming slides. So for all of our forecasts, we wanted to evaluate their forecasting skill, how well they're able to forecast dengue cases at each month. And so we used what's called a log score metric. So it's a measure of forecast skill. We bounded it to range from -infinity to 0. And the way that we estimated this was that we took the forecasted cases for each time point in our testing data, along with the observed cases and the standard error from those monthly forecasts, and generated a probability estimate. And so this is what we use as a measure of forecasting skill, doing this for every forecasted dengue cases in a given month, but also looking at this measure for all of the models we evaluated for each location over time. So using this kind of log score metric, we can evaluate both not just how a forecast performs at a given time point, but we can look at how it performs over different horizon times. So, how well does this model perform trying to forecast 1 month ahead versus 6 months ahead? Not only that, but we can look at different geographical scales. So seeing what models perform better at either a regional level or maybe at a country-specific level. And I'm not going to go into too much detail about kind of these monthly forecasts, but I thought I'd show an example of what some of these look like. The reason also we're focusing more on kind of aggregated comparisons of these different models and their forecasts is that, given the number of forecasts we generate, we have roughly 1.2 million monthly forecasts across our entire locations. And so just kind of given the volume of data, it's at this point, we're trying to see what the trends are both at the country level and national, regionally. So this first example is from Puerto Rico. So these are showing monthly dengue forecasts using an AR1 model. So just using dengue cases from the month before as the indicator, and showing the forecast for both 1 month ahead and 6 months ahead. And we can see that, for forecasting 1 month ahead, the model performs fairly well. It captures a good amount of the pattern of the dengue time series, though seems to be missing the peaks and kind of the timing of the low periods, but still has a fairly high correlation. In contrast, when we're looking farther ahead in time, 6 months ahead forecast, we see that this AR1 model doesn't have very good forecasts of the observed cases, missing in general the overall pattern, and you can also see just a wide range of uncertainty from this type of a forecast. One other example is from Amazonas in Venezuela. So this is showing forecasts using an AR1 seasonality and El Nino indicator model, again, for 1 month and 6 months ahead. As we see again, for the 1 month ahead, these models do seem to perform fairly well, still with a high correlation of the cases, of the observed cases and the forecasted cases, though this model still seems to miss, the timing of the peaks of the observed dengue cases, but also missing a bit of the magnitude. And again, with forecasting farther out in time, we see that the 6 months ahead model doesn't really capture either the temporal pattern or kind of the magnitude of those cases. So we can look at these forecasts over time. We can also look at what their forecasting skill looks like at an aggregated level. And we can also look at what the forecasting skill, how the forecasting skill changes as we're trying to forecast over different periods of time. So this is showing the average Lux score for each model that we evaluated over different horizon times. So each dot is reflecting the average Lux score of a model at a given horizon time. And what we see just generally is that as we're trying to forecast farther out in time, we just see a general decrease in forecasting skill. And obviously there's a bit of grouping, so some models performing better than others, even as forecast skill declines over time. But we can also look at, which model has the better forecasting skill over time, and that seems to be at this point an AR1 seasonal factor model. So another useful way to look at this type of data is not just, what do they look like over time, but with that, but at each horizon time, which model seems to perform better, and is there one that is consistently a better performing model across these different horizon times. So this figure here is showing the average log score of each model, at least at the 1 month ahead forecast. The black dot is showing our reference model, which again is the past average dengue cases. And the dashed line is just reflecting its average log score. And you can see that there's a bit of grouping of these different models. So kind of individual indicator models having log scores that are much closer to our reference model, with the exception of an AR model. But that other models that have at least an AR1 term in them seem to perform much better and have fairly similar forecasting skill. So we can look at this at each horizon time. And we can see that as we are moving across horizon times, that generally all of these models decrease in their forecasting skill, but that you also start to see certain models standing out as having better forecasting skill, even as they're losing their forecasting ability. And again, kind of the model that seems to consistently perform well is this AR1 seasonal term. And these are just looking at, the model forecasts, but we know that there are certain differences across locations that might impact, the model's ability to forecast well. And so we wanted to look at what some of the factors are that might explain, the heterogeneity in forecasting skill across these different models. So what we did was we used a number of linear regression models, generalized linear regression models to identify different characteristics associated with forecasting skill. And for this, we used a metric that's called the surprisal, which is really just the log score times -1, where the lower the surprisal estimate, the better the forecasting skill. But we evaluated different characteristics such as the horizon time, so looking at how the forecasting skill changes as you're trying to forecast farther out in time, the country for a given location's model, the length of the model building data available. So you remember that our data set has a lot of different lengths of time series. So does having a longer time series seem to have any effect on the forecasting skill? And then also the population size of a given location. And I won't go too much into detail about what that analysis really was, but generally we just found that the factors that were most important for impacting forecast skill was the length of training data available. So longer data does seem to be providing better forecasts, that there is just a lot of variation of forecasting skill depending on the country of a location. And then again, with horizon time showing that, farther forecasts that we're trying to make farther out in time do seem to have a decreased forecasting skill. We can see how this surprisal or this forecasting skill changes compared to our reference level or reference model after we account for these types of factors to see if there's consistency in which model seems to perform best after accounting for differences such as length and training data. So this figure here is showing the relative change in surprisal comparing all of the models in our data set to the base model. And so one is the reference compared to the base model. So, a better forecasting skill is related to a lower relative surprisal estimate. And again, you can see that as we move forward in horizon times, we see this decrease in forecasting skill, but we still also see that after accounting for these differences across, our models, that we still see that the AR1 seasonal model is still kind of the model with the best forecasting skill. Not only that, but we see that there are a couple of other models that seem to have similar performance. Those seem to be an AR1 seasonal model that includes indicators of El Nino and a regional dengue time series. So really starting to suggest that for forecasting dengue, it's useful to have information at the regional level for what's happening with dengue to inform local forecasts, but also that El Nino is an important indicator, which might suggest that that might be an important driver of dengue across the region. So I've shown mostly kind of aggregated forecasts at the regional level. We can also see what these forecasts look like in terms of their skill for different countries. So this figure here is just showing the surprisal estimate for each of these models for each country that we evaluated. So the dashed line is just showing the surprisal estimate for our reference model, which again is this kind of past average dengue cases. And you can see kind of consistently across all of these countries that the individual indicator models still have similar performance to our base model. And you see this grouping of models that have a combination of indicators that seem to include the AR1 term that have better forecasting skill at 1 month ahead. And that's what we see in this little highlighted box here. And again, we see that, in general, for 1 month ahead forecast, these models that have an AR1 indicator seem to perform fairly well. But we can also look at how they performed 6 months ahead. So that's what these red dots are now indicating. These are the surprisal estimates for models that are trying to forecast 6 months ahead in time. Again, you see there's a general decrease in decrease in forecasting skill across all of these models, with some individual indicator models performing even worse than our reference model. But again, you start to see this change in some of these combined models that seem to be performing better generally across the entire region. And again, these seem to consistently be the AR seasonal model, along with an AR seasonal regional model and an El Nino model. So kind of seeing this consistency of model performance has been able to inform us that at least if we're starting with a base model that we would recommend to different ministries of health, we would probably want to say that an AR seasonal model seems to perform fairly well and is probably a good base model to start with if you're trying to develop forecasts for your country. So in summary, what we found was that forecasting scale decreases as horizon time increases. That's not really a new finding, but it's nice to see the consistency of that and really kind of highlighting again how challenging it is to predict dengue 6 months ahead in time. At the regional level, we did identify kind of a common model that seems to perform well, and that again is the AR1 seasonal model. Even after accounting for different factors that might impact forecasting skill, we again found that that still consistently is the best performing model for forecasting, but also showing that an AR1 seasonal model with an El Nino term or with a regional term also has similar forecasting ability at 6 months ahead, even at 6 months ahead, and really suggestive of potential drivers of dengue across the region. So in summary, I think it's useful to also mention that, this analysis is limited by a couple of things. Like, as I mentioned earlier, we don't have any information about demography as an indicator for our forecasting. So that might be, an important metric or indicator that we're missing. Again, we also don't have mobility data, which has been found to be useful for forecasting dengue, at least in Thailand. But given the historical time series we're working with, much of the mobility data that's used more currently wasn't available at that period in time. And also because we don't have information on serotypes circulating in different countries, and we're probably missing a useful indicator about changes in immunity across the population. But for some of the next steps, we're hoping to incorporate some ARIMA models and SARIMA models, which help to account for more seasonal variation, but also long-term changes of dengue into this analysis. There have been studies that have shown that these perform fairly well in places like Mexico. So doing a comparison of how these models compare to the models that we've already looked at in our approach. And then to try and validate some of this, we're using a random forest approach, and that work's being led by Velma Lopez at CDC, where we're hoping to see, if using the same data and the same variables produce kind of the same conclusion about which indicators are most useful. So hoping to validate what we find and maybe see if there's other combinations that are useful for forecasting dengue across the region. So with that, I'd like to just thank all of the governmental collaborators that we've worked with to do this analysis, as well as a number of academic collaborators who helped us to be able to use this data. And again, the collaborators that I have at CDC, who I still continue to work with on this project. So with that, I'll stop there, and thank you for your time.
Thank you so much, Talia. That was a beautiful, like visually beautiful presentation, and also just substantively so interesting and so important. Thanks so much. I've mentioned to everyone attending that if you have questions for Dr. Quandelacy, feel free to put those in the chat. I think Ruby and I will also be monitoring any raised hands that come up. I personally have about 42 questions for you, so I will exercise self-control, but I'll take the liberty of maybe just leading with one question, if that's okay.
Sure.
Yeah, so many interesting observations, but one that really stuck out to me was obviously the AR models seem to do really well just as a start, but within that, it seemed like you got a pretty great marginal gain from having a sort of broader data set, so more regional data is more helpful for these models being able to predict what's going to happen in the future. That seems to have implications for sort of cross-border and like multinational collaboration if people are going to start to really be able to predict with any reliability and then hopefully do something about it. Has this project kind of, in the process of like building all these collaborations, but also your findings, has that sort of changed the nature in which people are talking about how to collaborate and how to sort of do better dengue control?
Yeah, I'm actually really glad you asked that, because as part of just this whole data collection, we've started this we're calling kind of like an analytical network. So pulling together, again, people who are in academia, who work in these fields and in these different countries, and partnering with ministries of health. And within that, we've started to work with PAHO to bring together different members of the ministries of health in the Americas to talk more about surveillance at the regional level, and kind of identifying the importance of knowing what patterns are happening within different countries, because they do, the tendency is you do start to see dengue occurring in one place, and shortly after you see it happening in another region or country. And so it really has kind of helped to create a larger collaboration and network of these ministries of health who've shown an interest in kind of the analytical analyses that we can conduct, and at least that we're sharing it back with these different member states, and hoping to help answer questions that they have of interest that maybe they don't have time for, or at least with our capability, we can provide that information to them so that they can focus on more operational functions. And so that's an ongoing effort that CDC is still doing with PAHO and these other member states.
That's really, really cool. I mean, it's really like analytically what you guys are doing is so sophisticated. And then at the same time, just the program management and the coordination between all these different bodies to me, it seems like so mind boggling. Like I can barely, handle like making my lunch. So that's amazing.
It was about a year of kind of just meetings and, talking with different people and so it's been a buildup.
I mean, a year is impressive. I could see this being decadal. So yes, a mystery guest named Kelly Searle has a question.
I'll turn on my camera. Hi, Talia.
Hi, it's great to see you.
It's good to see you too. That was really, really, really great. And so, like, I know you've mentioned a couple times about like mobility factors, and like we know there are tons of limitations on like how to even collect human mobility and then what to do with it. But that got me thinking about kind of other data sources, specifically like mosquito mobility. And so my question is, have any of kind of your participating countries implemented data collection for the Aedes vectors? And are there plans to integrate that into the surveillance data? And do you think that, like, what sort of information would that bring to your models? Because I mean, we all know, like, as a vector-borne disease, that's an important factor.
Yeah, no, that's a great question and a great point. At this point, I know mosquito surveillance is fairly limited, and even for locations that do have it, it's kind of like, strategic locations where they're doing mosquito sampling. And so at this moment, most of the data sets that are currently available are kind of fine scale resolution, like projections of where the mosquito vectors are. But I agree, I think that is probably something that we haven't incorporated that should at least maybe be evaluated to see if it's useful. And at least, be able to maybe validate that at some point. But yeah, at the moment there isn't too much mosquito surveillance regionally, but I think that is something that is, I think, becoming more important to account for, just given kind of the changes in the geographic distribution of those host species. Yeah.
I feel silly to call on Ruby, but yes, Ruby.
So I'm actually asking a question, I think, on behalf of some of the new folks here. So just so that you know, some of the new folks are actually new to epidemiology. And so I welcome them to ask their questions. In fact, right before we started, Dr. Smith and I were talking about how naive we are both to arboviruses, yet we were trained in infectious disease epidemiology. So we are all new to something. So undergraduates know that. Anyone else who's new to our group, feel free for you to ask a question. So my question is this, with regards to all of the models over time, understandable how a model 6 months out may not perform as well, totally understandable. But with your own work modeling, as well as your collaborations with folks in field or in country, really what more can be done with regards to the difference between modeling out for 1 month and modeling out for 6 months? So why do we care programmatically about modeling out way to 6 months?
Yeah, so I think, and that's really good point that maybe I missed in the earlier part of the talk, but I think the useful thing is that, the more time you have to know that there's an epidemic coming, the more you can do to prepare the population, either by reducing risks such as, removing, stagnant water from water pots, or by doing more insecticide spraying ahead of time to actually have an impact on the mosquito vector with enough time that will actually reduce transmission. And the better you're prepared for any potential surge, the more time you have to focus on preventing infections and then hopefully treating people, but at a lower scale of what we might have expected if we didn't do anything. So that's why kind of predicting 6 months ahead is really helpful at an operational or programmatic standpoint. And it's been a challenge to do that. There's a lot of models that are able to perform well 1 to 3 months ahead, but for predicting out farther in time is still a challenge. And I do think there is utility in looking at kind of these month-to-month predictions, because it's useful to know kind of when is the start of an epidemic, how well can we forecast that, when is the peak, and are we capturing that peak in the number of cases there well. So that is actually a next step that we're trying to expand to after we do this kind of initial analysis.
I don't know if you've seen, but Talia, we have a few questions in the chat. I didn't know if Claudia, Dr. Munoz-Sanzi wants to ask her question. Claudia, do you want me to just read it out loud?
Oh. No, I can turn on my phone. Yeah, I can say it. Thank you. Very nice to meet you. Thanks for the presentation. Well, so my question had to do with the scale of the forecast. We're just finishing another project where we're doing this for yellow fever. And we feel very strongly that we wanted to do it at a small scale because the message to prepare a whole country, for an upcoming potential, increase, the message is received differently in different places. Yeah. So we were basically pushing, and we did ended up doing municipality level forecasting. So in your opinion for dengue, do you think it's worth, knowing the difficulties and uncertainty and smaller sample sizes, do you think it's worth pursuing smaller scale, spatial scale analysis?
I definitely think so, especially just within countries, how much heterogeneity there can be with transmission. With our analysis, we're a little limited in the spatial scale we can look at because we do only have province or state department level data. But even when we've looked at that, there still is a bit of heterogeneity in which models perform well within a country. And at this point in time, we're just focused on kind of what regionally and at country levels work well in terms of a forecasting model, but we're trying to figure out an approach that can let us incorporate some of the different location specific information, understanding that there is a good amount of difference in what models might be working better for specific locations, and trying to convey that in a more kind of location specific way. So yeah, I definitely agree that I think it is important to do these forecasts at a smaller spatial scale. And I think it is actually really useful to be able to tailor that information for a different location, especially given, there is just differences in dengue incidence, across different places in a country. So I think it is really important to consider those heterogeneities.
Yeah. And I think just to, I totally agree with you. And I think that for dengue in particular, which is such an important disease, we really need to advocate for better data. As we're probably all we're saying this again and again about standardizing, diagnosis and then reporting.
Yeah, no, definitely. I definitely agree with you. And I think, we're trying to, a lot of the countries have given us these data sets, and a lot of these aren't publicly available. And so we're analyzing them and giving this information back to the ministries of health, but also hoping to engage in conversations as we kind of move forward to publication, that we can share some of this data that hasn't previously been available, at least, based on what a country gives us permission to share, but so that at least, maybe we can help improve kind of some of the visibility of some of this type of data.
Awesome. Thank you.
Dr. Jacobs wants to know how we monitor mosquitoes, migrating mosquitoes.
I'm not the best person to answer that question. I can't say too much about kind of monitoring it on large scales. I know there have been a number of studies that have tried to look at, tagging or like radio fluorescence labeling of mosquitoes moving from like households or from one small location to another. But it's a fairly challenging endeavor. So, I think that is definitely a place where we need to improve our understanding of kind of mosquito movement.
We do have time for one last question, if anyone is brave enough. Can I ask on behalf of the undergraduates then, Dr. Quandelacy, can you tell us your trajectory into epidemiology. What major did you have as an undergraduate, and where did you train, and what, and in what?
Yeah, I will at least just start with my initial interest in epidemiology started when I was like 8. I grew up in the Zuni Reservation in New Mexico, and we had the hantavirus outbreak there kind of around the time that I was growing up, and that was, I think, a fairly influential event for me. But I majored in, I did a double major in community health and biology at Tufts University, and their community health program had a real strong focus in racial and ethnic health inequities and disparities. So you know, that's always been a real interest of mine, but also wanting to understand, you know, the impact of health on Indigenous populations. You know, I've studied in global health mostly because there's a lot of parallels with some of the issues facing Native American populations and other areas internationally. But that's, you know, kind of the initial start of my interest, and have moved into epidemiology after working with the special viral pathogens branch at CDC studying hantavirus in different parts of the Americas region. Yeah.
Fantastic. Thank you so much. This has been fantastic, Dr.
Thank you for
Quandelacy.
having me.
And hopefully we'll be able to see you in person someday. And thank you to Dr. Smith for the introduction to you and co-moderating today. So thanks, Kumi. Everyone else, we hope to see you back next week for an alum who will be speaking on anti-racism and public health, Dr. Julia DiCaprio. It will be co-sponsored by the Center for Anti-Racism. So hope to see you back next week. Have a good week until then. Bye-bye.
Thanks, Talia. Take care, all.
Thanks for having me.
Yeah, good to see you.
Bye.
Talia.
Yeah, nice to see you, Kelly. Bye.